And just the last kind of food for thought little statistic, from July 2011 to January 2014, we have administered 761 post-injury impact tests. So that's a large number. So,
Bree,
yes.
do you want to tell everybody about when baseline testing is done for impact testing? I think that's important.
Sure. We try to do baseline testing 3 times in a high school career in grades 7, 9, and 11. We do every other year to allow for brain development and growth. It's not a ton that goes, year to year, so we go every other year. And ideally, we do our baseline testing prior to them actually starting into any kind of organized sport because we want to get the most accurate picture of the athlete. So we try to get them before they start in basketball practice, before a chance of injury occurs, and also before they're just tired and cranky and I just came from practice and I don't want to sit here and do a computer test. So 7, 9, and 11 prior to the start of their organized sports season is when we do our baselines.
We discussed a lot of information this evening on concussions and what they are, the symptoms you're going to see, some modifications regarding how you can help your son or daughter that is concussed at home, some statistics showing the increase in the reporting as well as the prevalence of concussions. We wanted to finish with a little bit on prevention. It was touched on earlier, but essentially one of the easiest things there is to help prevent a concussion is to wear a helmet. As Mandy had mentioned, a lot of kids report having a helmet, they don't wear it. A lot of kids report the amount of decrease in the percentage of a concussion just with wearing a helmet was very dramatic. And so what we found is as the concussion in the mainstream continues to be more and more, and people are maybe even starting to consider whether or not they're going to let their child play football, let their child play ice hockey, making those kinds of decisions based upon the fear that they may have of their child suffering a head injury. They then, on the other hand, will still let their son or daughter go home and ride a bike without their helmet on, or skateboard without their helmet on, or ski without a helmet on. So when you're looking across the picture of what we can do to help prevent that, the incidences of concussions are going up, and that is correct, mostly probably because of better reporting and research. But it only takes one incident, and that incident could happen in football, it could happen as you ride your bike. So by wearing a helmet when you're participating in these activities of bike riding, snowmobiling, scooters, ATV riding, contact sports of football, lacrosse, and ice hockey, inline skating, running the bases, playing baseball and softball, riding a horse. We see a tremendous number of concussions that occur in the wintertime due to sled riding accidents, snowboarding, skiing. We have a lot of times it's not necessarily a wreck. Sometimes it's just when they, slide off the board, and the ice can be very, very hard, and they'll smack their head on the ice. It doesn't even necessarily even have to involve an accident on a sled. It can just be a generalized dismount off a sled, and they can, hit their head. And those things do happen. So wearing a helmet is very important, as well as making sure that helmet is a proper fit and then is maintained throughout the year. So if you have a son or daughter that's playing 6th grade football, 7th grade football, 11th grade football, they're fitted with that helmet at the beginning of the year. Now, do they have physical changes as the year goes on? They may lose or gain weight. The helmet itself may have parts of it that get adjusted, screws become loose. So not only needs to be fitted properly initially, but it needs to be managed throughout the year and maintained to make sure that it maintains a proper fit so that it's providing the protection that it's supposed to. Along with the helmet is also using the other protective gear that's provided. A mouthpiece. I don't know how many of you have seen, we see it every year. You go out to football camp and all the kids have trimmed off their mouthpiece so that there's only this much showing, it's not connected to their helmet, so that when they accidentally swallow it, when they have an injury, it's so much easier to get out when there's only a quarter of an inch sticking out instead of the whole thing. Or they'll take it and they'll they'll trim off the backs so that it just covers their front teeth. Well, you know, the mouthpiece, as we had mentioned earlier, when you take a shot through the jaw, that's a great way to really rattle your brain. If you've ever watched, you know, mixed martial arts or boxing, you know, a lot of times that knockout punch, that bingo punch, is when that person gets hit right in the chin. And that's when they'll go, you know, face first down. That's when they are out. And a lot of that happens through the chin. And so that gives a rattling of the brain. So when they make those modifications to their mouthpieces, that can be problematic. And as well, another piece of equipment that needs to be maintained. And they chew on it all year long. You know, it's something where they need to get a second mouthpiece halfway through the season. Proper techniques, tackling, blocking, you know, all of those things are very important. You know, that, as we had mentioned with the coaches now in the PIAA, they have to participate in online education. A lot of that involves the proper techniques of teaching those types of things, as well as then the recognition skills that they have afterwards. So definitely using the proper techniques when you're participating in the sport that you're involved with. Following the rules. And one of the greatest rules of football is you don't lead with your head, the crown of your helmet. And then if you watch a game on Saturday during college football, Sunday during, you know, high school, or professional football, and then we'll see it on us, you know, on our sidelines on Friday night high school football games with kids leading with the top of their heads. And so not only are you creating a big risk for a concussion, but you're also setting yourself up for, you know, cervical injuries and much more issues in those regards. But again, that's what they see on TV. You know, a lot of what we deal with are what some of our athletes see on TV. They see that, you know, Ben Roethlisberger came out of the game with a concussion and was back the next week. You know, they see that some of the big hits from some of the safeties and cornerbacks come, you know, where they're leading with their head, and so those are some of the things that we have to battle with. But obviously follow the rules, especially those that pertain to safety. Practice good sportsmanship. You know, sometimes that's where you'll get an injury. Like we had mentioned earlier, somebody's a little bit off guard because the whistle blew, and then somebody gets hit. And so that, you know, that's something where, you know, we instill that good sportsmanship with our athletes, then we're able to try to prevent some of that stuff. You know, an athlete has completed the play, the whistle blows, and that's where it stops. Somebody that hits them after the whistle, they're unprepared for that hit, and then you can get that whiplash type effect and end up with a concussion. And then the Safety and Youth Sport Act, that was a General Assembly bill in Pennsylvania that was passed in 2012. And essentially that has laid the groundwork for a lot of the stuff that is getting pushed into the high school setting now that we've pretty much been following since 2005. It is the program that has now required the coaches to do concussion training online. It has set up a system that essentially they want a system in place that helps to diagnose, follow through concussions, which is something that we've been doing you know, for quite some time now, in providing the ability to recognize that an injury has occurred, be able to assess it appropriately, and then manage that athlete from the onset of the concussion all the way back. They set up some guidelines for who can do concussion management. That bill is the one that has said that not everybody can just, even if you're a physician, if you don't have some additional training in concussion and concussion management, then you should not necessarily be the one that's releasing somebody back to participation. They want individuals that have further education in those areas so that we follow through with making sure that those kids go back safely. Because as you had seen throughout the information that we provided today, some of these things can be very long-term. And we see that every year. We see a kid or two that has a concussion that occurs early on, and it takes 1 to 2.5 months to get that athlete back. Variety of factors, not letting their brain rest like we discussed. Younger athletes. The younger athlete is certainly a little bit more potential to have longer problems. They have a developing brain. So if you take a 7th and 8th grade boy who's already maybe a little screwy to begin with because they're maturing and developing, and then you put a brain injury on top of that, then they can really you know, be a longer terms in regards to trying to come out. And one of the big things that we see with concussions, as well as some of the other injuries that we see, is the the social networking that is involved with that athlete in the sport that they participate in. They're a football player, they're a hockey player, they're a wrestler, soccer player, girls basketball, and their teammates depend on them. And those teammates' parents depend on, there's a whole line of things, and now you remove them from that, and then you suggest that they not play video games, not talk on their cell phone, not text. You're crashing this 16-year-old world down. So that supportive aspect of what you see and work with is very, very important to those athletes. One of the other things that I forgot to mention as far as prevention goes is making sure that the athlete is in good shape. We want to make sure that they have a good structure, as Whitney had mentioned with the bowl of Jello. If you've got somebody's head on a little pixie stick compared to a baseball bat, you've got a much more secure structure. So if we, along with proper techniques with tackling and those kinds of things, we have the ability to make sure that we do good strength and conditioning. Make sure that if the person is not skeletally mature or have the strength enough to do the activity that they're doing, such as some of our younger athletes may be heading a soccer ball, maybe that's something that needs to be looked at to make sure that it doesn't happen. So, prevention is challenging, and there's always going to be concussions, and it only takes that one event, and it can happen in a variety of manners. But a few safeguards can certainly help in that aspect, especially wearing a helmet when you're doing some of the things that when they're doing certain activities that you might not consider normally necessary. So, Dr. Williams, do you have anything to add or expand upon?
Oh goodness, that's like opening a can of worms. I don't think you want me to expand on a lot, but I could probably expand on one or two things and then
Sure.
maybe take some questions.
Absolutely.
That might be the easier way to do it. I think Mike really said it well about prevention, and maybe a point to drive home is a point that we all miss, maybe a myth or a fallacy that the common person thinks of, is that kids' concussions are milder and they recover quickly and they're not as severe as somebody who is older, and that is absolutely a fallacy. A concussion in a child or a teenager should be taken much more seriously than a concussion in an adult because of their developing brain. And it's the developing neurons, and the nerves are not completely covered with myelin that get injured, and they take a longer time to recover. So in the past, they would say, that's okay, he's 12, he'll be better tomorrow. That's absolutely wrong. They need more time, more attention, and more concern for recovery from that concussion. And then I think one of the things we haven't mentioned was the second impact syndrome. We're all talking about concussions and preventing them, and why are we paying so much attention to concussions? And the reason is to prevent that second concussion immediately after the first, because the second impact often causes death. And it's what you read in the newspaper. It's what you read about the football player who was out there and he didn't tell the trainers and the coaches that he had the first concussion and he got the second one. And the reason that happens is very metabolic more than anything. When we mention the fact that there is not structural damage, there really is not, that we can see by our tests at the current time. But is there structural damage? Absolutely. There is cellular damage. There is damage that takes place at the cellular level of the brain. And what happens when we have cellular damage? Think about an injury to the skin or a bruise. Now, I'm not saying the brain is bruised because that's a different injury, but if you have an injury to the skin, like a blister or a burn, hot water, and you get burned and you look and you say, there's nothing there. And then all of a sudden, 10 minutes later, there's a blister. It's because there's a cellular reaction. We release vasoactive-amines, and the cells are reacting to that injury. In concussion, very similar thing happens. And the cells become very fragile. And that's after that first concussion. After the second concussion, those fragile cells can bleed. And then that big structural bleed is what causes death. And so the importance in all of this is preventing death in our athletes. And nobody wants to think about that, but that is really what we're trying to do here. Every athlete, whether it's the soccer player, the motocross rider, the football player, it's really preventing that second concussion to keep them from dying. And then in the process, we've learned about the whole process of concussions and all the other effects, the side effects, the symptoms that we can deal with. And all of those things happen because of the cellular changes. And although we don't have any tests yet, there is lots of research. And we're going to very soon. There are biomarkers they are looking at, blood tests we can do that can take your child in the emergency room, and we can test for neurotransmitters. And has there been a release of this neurotransmitter that says, aha, their brain has been injured. And then they're trying to use that as a marker to say, they can't return to play until that comes back down to normal. So there certainly are things on the horizon to make this a little bit easier for everybody. And the question I get most from parents is, why do they have all these problems if there's nothing wrong? If their brain isn't damaged and we're not worried, why do they have all these problems? And it again goes back to an analogy I use for everybody to understand. It's certainly not scientific, but my analogy is with loss of electricity to our house. And I say you can have a big loss of electricity to the house, you can have a very quick brownout. And what happens to our appliances when we have quick loss of electricity? Some of them come back on with no problem at all. There's no flashing lights, there's no anything. That could be a very mild concussion. What happens when it's a little bit longer? It comes back on, we have flashing lights. Your brain is like that flashing light in the concussion. All those electrical connections haven't quite made it back yet. They're all not working on 100%, and the brain will present that disorganization and that attempt at reorganization by things like behavioral disorders, emotional disorders, intolerance to light, headaches, while it's trying to reorganize. And that's why the student, the athlete, needs a quiet environment. They can't have multiple things happen at the same time. They can't have music going on and somebody talking to them and trying to do video games, because it's too much stimulation for this brain that's trying to reorganize all these neurologic patterns. So it's why things need to be quiet, why they need to be dark, why they need to sleep more in order to let that brain reorganize. And severe traumatic brain injury is the extreme of that, where we have to do extreme repetition of motions to get those neurologic connections to work the way they used to. And so concussion is the mild end of that. So that's probably the areas that I would mention the most that I think kind of got skipped over. But otherwise, I think everybody did a fabulous job. I think you did a great job in explaining to everybody why this is such an important thing. What kind of questions could we answer for you?
So I've had multiple concussions, and 2 that were diagnosed. And I specifically remember 2 different trainers managing them for me. And the one was probably 15 years ago, and it was, well, say the word, I'll tell you 3 words, repeat them in a couple minutes, and then if you repeat them accurately, you're good to go. The other one was, I was out for a few days and managed and watched and observed. The prolonged side effects in each one were profoundly different. The second one had much longer side effects. I mean, I had headaches for extended periods of time. But really, after the 72 hours of observation, they kind of let me go along my way, and I was back to playing sports. When should we really, at what point, as we're observing kids or our own children, do we say, okay, it's been a couple months, but you still aren't acting right? How do we really recognize that he's not just lazy, he's lethargic?
Excellent question. And initially, after the mild concussions, it really is that 72 hours to 7 days when most people recover. Post-concussive syndrome, which is the persistence of that constellation of symptoms, can last anywhere from 2 weeks to 6 months. Sometimes a little bit longer, but in that case, I hesitate to call it post-concussive syndrome as much as I think that people really had mild traumatic brain injury, as opposed to just post-concussive syndrome. Because post-concussive symptoms do go away. Mild traumatic brain injury, you would have a permanent deficit. So for your own children, it's really watching them through those next couple weeks and couple months And how do we let them back to activity? It really is about symptoms. I see quite a few kids that last beyond